In the evening, a client experiencing abdominal pain arrives at the emergency department. The nurse in charge of triage performs an abdominal pain assessment exam.
Okay, number 47 to the triage room, please. Hi, my name is Philip, and I will be the triage nurse for you today. Just have a seat right here. So I'm going to need your provincial healthcare card as well as your hospital card.
Go.
Thank you. Now, could you just confirm your name for me?
Julian Gagnon.
Okay, Miss Gagnon. And what seems to be the problem today?
My stomach hurts so much. I don't know what to do anymore. I've tried everything to ease the pain, but nothing seems to work. I'm worried it could be something serious.
Okay, so what we're going to do is I'm going to ask you some questions in order to better understand your symptoms.
The nurse needs to access the client's file in the database in order to record into it any relevant information obtained while conducting the medical exam. During the pain assessment exam, the nurse uses the PQRSTU quick reference tool to formulate the questions to be asked to the client. Doing so will enable him to gather subjective data before conducting the physical exam. The first series of questions correspond to the letter P in the reference tool. Provocation and Palliation. They enable to establish the cause of the pain as well as the factors that could aggravate or alleviate it.
So tell me, what were you doing when this pain first started?
I was sleeping, and then I suddenly woke up in pain.
Is there anything that you do that aggravates the pain?
Whenever I cough or I take a deep breath.
Okay. Have you tried anything in order to alleviate the pain? Have you taken any medication?
I'm feeling all right when I'm lying down on my back with my knees bent. I tried to put some ice on the pain, but no result. And I haven't taken any medication since I don't have any at my house.
Okay.
The second series of questions correspond to the letter Q in the reference tool, quality and quantity. They enable the patient to describe the pain and its seriousness and acuteness.
Okay. How would you describe your pain for me?
I don't really know how to describe it.
Would you say it's like a cramp, or is it more of a sharp, stabbing, tearing, numbing, or crushing, or a burning pain?
I would say feel like a sharp pain.
Right above my navel.
The more time passes, the more it shifts to the right side of my abdomen.
Okay. And on a scale of 0 to 10, 0 being no pain whatsoever, and 10 being one of the worst pains ever, how would you rate your pain right now?
Oh, I would say 7 to 8 out of 10. Yeah.
Okay.
These questions correspond to the letter R, or region, in the reference tool. The answers provided allow to make a distinction between a localized pain and a radiating one, and will guide the nurse for the next steps.
Now, can you point to the exact location of your pain?
Right here.
And are you feeling any pain anywhere else other than right there?
No, it's really limited to this area.
Okay.
The next question corresponds to the letter S in the reference tool. It allows to pinpoint the other symptoms felt by the client and gather additional information regarding her overall condition.
Do you have any other symptoms other than the pain that you've already mentioned?
I've been feeling nauseous and hot since I've gotten up this morning.
The questions that follow correspond to the letter T, or time, in the quick reference tool. They allow to pinpoint when exactly the pain first appeared and how long it actually lasts. Thus, the nurse can differentiate between acute and chronic pain.
Now, when did you first experience this pain? Would you say it is intermittent, constant, or throbbing?
When I woke up last night, about 8 hours ago, and then
I would say it's constantly increasing all the time.
The final questions correspond to the letter U, or understanding, in the reference tool. The client's understanding of the pain and its probable cause. They also allow to know if this is the first time the pain has appeared, and if so, how the client has dealt with it.
So tell me, have you ever felt a similar pain before? And what do you think might be the cause of this pain?
It's the first time that I felt a pain like this, but my spouse has already had a similar one a few years ago.
It was due to an appendicitis, and he required prompt surgery to remove his appendix.
Okay.
Once the interview to collect subjective data from the client is done, the nurse then needs to conduct a physical exam. The extent of the latter will mainly depend on the information given by the client and provide relevant objective data. Thus, the nurse will be able to formulate his exam findings and determine the level of medical observation needed.
So what I'm going to do, in order for me to complete your evaluation, what I'm going to do is I'm going to measure all your vital signs as well as conduct a full physical exam. So we're just going to transfer over here to the bed. Okay, I'm going to have you slip this smock on, and I'll be with you shortly.
Okay, thank you.